AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is day 3 of ACLM week. What is ACLM, you might ask? Well, it is a wonderful organization called the American College of Lifestyle Medicine. And each day this week, we are featuring one of their healthcare professionals. To introduce today's guest, we have the Director of Communications of ACLM, Alex Branch. It's nice to meet you, Alex.
Thank you. It's great to meet you and great to be here. I'm very excited to introduce today's guest. It is Dr. George Guthrie. He is a very, very involved ACLM member. He has a very interesting backstory as to how he got interested in lifestyle medicine. For the first 7 years early in his medical career, he served on the island of Guam, where he saw a very high incidence of type 2 diabetes in the population living there, and triggered a keen interest in the effective treatment of chronic disease through lifestyle change. In order to deepen his knowledge in that area and be more effective in his practice, he went back to school, earned a master's degree in public health with a focus on nutrition from Loma Linda University. He has helped develop several lifestyle change programs, including the Complete Health Improvement Project, the Wellspring Diabetes Program, and AdventHealth's Creation Health Program. He's very active in the American College of Lifestyle Medicine. He has served there in many roles: Secretary Treasurer, President-elect, and President. And still to this day, one of his greatest joys is seeing his patients and community members embrace the principles of whole food, plant-based eating and watching their health transformations. So with that, welcome to the show, Dr. Guthrie.
Thank you. Pleasure to be here.
Wow. So Guam, that is so interesting that you noticed that all those diseases on the island.
They're actually really common in the Pacific Islands because, well, for a variety of reasons, I suppose, but the Pacific Islanders have often not had as much nutrition, things available. And then the federal government has ended up bringing, for many of them, put in a lot of kind of our refined foods as they kind of send them out. And it ends up that diabetes is a real common disease in all of Micronesia.
It wasn't always that way though, right?
That is correct. That is absolutely correct.
So what changed? I'm going to guess it starts with an F.
Well, let me tell you the story of one of my patients. When I was on Guam, he was a Chuukese, or from the island of Truk. You may remember hearing about the island. We call it Truk, our kind of Caucasian way of saying it. The islanders call it Chuk. Much of the Japanese Navy was actually buried there from a battle in World War II. So a lot of diabetes. And here I am working in Guam in a clinic, and a Chuukese gentleman and his wife come in. And his wife is having some sort of a female problem. I don't remember what it was, but I helped her with it. And 2 days later, he was back and he said, "You were so kind to my wife. I need your help too." And Simeon explained to me that he had some joint pain and it just hurt him to move. And he wanted to know what I could do. Well, I looked at him and I knew he was overweight. I asked to do some laboratory tests. And when they all came back, he had diabetes, he had high cholesterol, bad osteoarthritis of his knees, and it was the obvious kind of degenerative diseases. And I said, about the second, third visit, Simeon shared with me that he was actually a senator on the island of Chuuk. So I had learned that, and as I spoke with Simeon about the results of his laboratory tests and his physiology and his symptoms, I said, "Simeon, the first thing I need to do is apologize to you for what the white man has done to you. White sugar, white Crisco, they love to make their white donuts, the soda pop, the Spam. I mean, all the Western food comes in and the people just love it. It's cheap, it's almost free and free in some cases. They take it and soon they have diabetes and heart disease and all kinds of trouble." So I said, "Simeon, first thing you need to do is to get back the way things were before the white man came. Eat the coconut, climb the tree, pick it, eat it. Eat your taro, take the greens, eat the root, eat your fish. but you catch it yourself. So, Simeon took me up on that. And in 6 weeks, he was back. He'd lost some weight. His knee pain was gone. He was walking. Over the ensuing months, he did so well with his change away from the white man's diet back to the way it was supposed to be, that his fellow senators told him, "We're going to make you chairman of the health committee." So, Simeon was head of the health committee, and he was doing great work, exercising. He lost the weight, joint pain went away. The islands are a place where there's a lot of this disease, a lot of risk, and it's often because of the white man's disease.
Right, because if they were just eating what grew there and not what was, imported, they would probably be fine.
So true. So true.
Yeah. I mean, it's amazing how processed food has really done a number on people in not just this country, but the world.
It is so true. Clear around the world, we see this happening. And of course, obesity and diabetes are increasing wherever there's success in development, and we start to get the processed foods, and these diseases tend to strike.
I'm betting there was a time a long time ago where there wasn't even diabetes on this planet.
Well, there's certainly populations where we know that's the case. That's correct.
Yeah, that's so cool. So I didn't realize you were a past president of ACLM. We had one on yesterday, Dr. Dexter Sherney. So that's nice.
Good.
Did they call you President Guthrie during your reign?
No, they call me George.
I'm just kidding. It just sounds like just a wonderful organization. I can't believe how many members go to the conference every year.
And they have excellent spirit. There's a great spirit. Doctors who really want to see people get better, encouraging patients to change their lifestyle. Nothing we like better than to share stories of patients that have made the change, gotten their life back, and made their disease go away.
Wow, that is so cool. Are you in private practice right now?
I am not in private practice. I work in an academic setting. So I'm in the little town of Orlando. Maybe you've heard of it, here in Central Florida. And I teach in a family medicine residency for AdventHealth, which is one of two main hospital systems here within the Central Florida region. Nice.
Very cool. I love that. Yeah, I know you have a book. I read it. It's very good. Do you want to show it?
Well, I suppose I can. I'm proud of it. When you go to wait a minute, is this going to work? Let's see if I can show it.
I know you're using a virtual screen. I know it sucks it in.
It just kind of fuzzes it out. Well, the name of the book is Eat Plants, Feel Whole. And it's been a great project to do with the AdventHealth team. We also have a journal to help people on their journey so they can get points for doing the right things. And so that's can be helpful. And then in the next month or so, there's supposed to be a cookbook coming out as well. So we're looking forward to having more people having access to Eat Plants, Feel Whole.
Someone actually, when they heard you were on the show and going to be talking about diabetes, Marie sent in a question in advance. And I know you can't give like exact medical advice, but maybe you can speak generally about it. And so she says, I'm looking forward to Dr. Guthrie's presentation. If you have time, could you ask this question about prediabetes to Dr. Guthrie? After a year plant-based, I've lost 12 kilograms and I'm now in my normal BMI. And while I have good management over my blood sugars these days, I still have to be very strict with the higher calorie density in processed foods like pasta or bread, even a little bit, and especially not with dinner. They can still raise my fasting blood sugars the next morning. Is there anything I should be doing to help get my insulin more sensitive? As well, I am postmenopausal, so I wonder how much hormones are impacting my insulin resistance. I notice the most difficult hormonal fat left to lose is around my middle. Many thanks for your terrific work and inspiration, Marie.
Wow, that's pretty nice. Well, I guess the talk really is focused on the reversible parts of diabetes. And maybe what we should do is talk about the irreversible parts of diabetes. The reversible parts And then, there's some of those things that change very quickly, and there's some things that change slowly. So let's talk about reversible or irreversible first, because that's probably the easiest to talk about. Okay. So if you've had bad vascular disease associated with the diabetes, and it comes along with the blood vessels kind of getting plugged up, you got an infection in your foot and you had your foot amputated. I don't think we're going to grow it back. Okay, you might have some sort of device put on it so you can still use it, and we're thankful for the technology that we've got. But there are some parts that are just not repairable. Kidney disease, for example, if the kidneys are shot, they may not be able to come all the way back. Those little nephrons are such delicate little things. If they're being stressed, often I've seen them get better. The kidneys have gotten significantly better, but they can be damaged to the point with the scar tissue that it just can't be repaired. So there are parts of the disease when it gets advanced too far that cannot reverse. Now, the things that can reverse are pretty exciting. Usually when we talk about diabetes, we focus on the blood sugar part. And we think diabetes is a blood sugar sort of a problem. It's actually much bigger than that. I am so glad that we do have some availability of other kind of tests or things to measure to help us know how the rest of the system works. So the way diabetes starts to begin happening is there's an insulin resistance. It can occur, yes, in the peripheral tissues like the muscle, and the muscle starts to say, no, I don't need any more of this energy coming into my cell or into myself. And so it makes this resistance. And when that happens, of course, the body needs to make more insulin. Insulin itself has some pathological effects. We think that the sugar is the problem, and it is, but the insulin is as well. Insulin tends to make our weight go up. Insulin tends to make the cholesterol go up. It's associated with high blood pressure. And of course, there's the whole cholesterol picture. So those things are kind of the outflowing of this increase in insulin when there's insulin resistance. Generally, that's considered prediabetes, and it doesn't become full-blown diabetes until the liver starts to get insulin resistance. So liver is a grand central station for energy management. Most of the food that comes into the stomach actually goes through the liver, and the liver will, grab the protein, grab the fats and carbohydrates and toxins, and it does what it's supposed to do. But one of the jobs for the liver is to make glucose or to release glucose into the bloodstream when there's no food to eat. So, for example, if you haven't eaten for 12, 16 hours, there's no more food in the stomach. Where does the energy come from? Our brain still needs energy. Other tissues need this energy. So the liver starts to produce glucose. Now, when we have break fast, when the fast is over and we have that first meal, insulin is then released and it goes to the liver and says, okay, there's food here. You can stop making glucose now. So that's normal. But if the liver itself has an insulin resistance, it's been asked to take more energy in than it needs. It has an insulin resistance. And so instead of turning off like it's supposed to, it just keeps pouring sugar out. So that's the liver insulin resistance, and that's kind of what causes type 2 diabetes or reaches the point where we diagnose type 2 diabetes. The process has been going on for some time, but that's when it really becomes clear. Go ahead.
I was just going to say, by the time somebody's diagnosed, they've, just like cancer, they've already had the disease in their body for quite some time.
Yeah, often years. That is correct. It depends on how many times they try to diet and lose a little weight. But yeah, it begins to happen. And you can tell when it's happening because your weight goes up. And again, it's hard to lose weight. Your blood pressure starts up, and very commonly the cholesterol goes up. So this is all part of that kind of pre-diabetes effect. So the lady who wrote in, asked the question, I had pre-diabetes. I've lost some weight now. So she's trying to turn that around. And we're very thankful for that she's done so well. She's lost some weight. That's extremely important. And but she's telling us that her blood sugar still goes up when she has kind of some extra carbs or a little something in the evening. It's up the next morning. What that is telling us is that her liver insulin resistance is not completely resolved. Or, I mean, there's another possibility that the pancreas is rather weak too and unable to make enough insulin. So it's just showing us that there's still some problems left. Some people think that their diabetes is completely cured when their blood sugar comes to a normal level. Well, it's not necessarily so, because there's the insulin effect inside and other things that we can go on to talk about as we continue to kind of develop the whole project. So I'm glad that she's moving in the right direction. She's doing the right thing. If she really wants to turn the liver insulin resistance around, make it go away, the best we have from a scientific standpoint is something called fasting. So if she would skip that evening meal, during the nighttime, her liver, which has a little bit of insulin resistance, would have to do push-ups. Now, I often will tell my patients, your liver, you can't take it out and make it do push-ups. The work that the liver does is to release glucose during the fasting state. So the longer we spend in the fasting state, the more of the fat leaves the liver, the more the insulin resistance of the liver tends to decrease and go away. But it usually takes longer than reversing, for example, the insulin resistance in the muscle.
Dr. Guthrie, you've used the word insulin resistance many times. And do you have like a really, for lay people, definition of what that is?
I do, and I don't particularly care for the one that is usually used about the lock and key, because to me, it's just not quite accurate. I first learned about this from a fellow by the name of Jerry Olefsky. This is back in the 1980s at University of California in San Diego. He was doing research on defining insulin resistance in the tissues, muscle, fat, and otherwise. It had, as I learned about it, it had a very good logic to it. Our bodies are built for balance. We use the word homeostasis. We need energy to come in, and each cell is going to have its particular need. But if it doesn't need that sugar anymore, it develops a relative insulin resistance. An example I often use is that of running a marathon. So if I'm running a marathon, my thigh muscles are doing a lot of work. If I take a little sports drink as I'm going along, that will go in, it'll go to my pancreas. My pancreas will sense the glucose. It will release the insulin. The insulin will go to my thigh muscles, and my thigh muscles will say, yes, give it to me. They're very insulin sensitive. Same body, same sports drink, same run. The eye blinkers will say something different. They'll say, well, okay, I'll take a little bit of it, because they're not working so much. You see, energy management in the body is at the cell level. It's not decided at the mouth. It's not in the brain. It's not at the pancreas. It's at the cell level. Each cell decides how much energy it needs and is relatively more or less sensitive to that insulin. That way, when energy comes in, it's distributed according to need. So when all the cells in the body, or almost all the cells in the body, are saying, I don't need that, we say that the whole body has insulin resistance. And that's where the disease kind of starts. If we let it continue, it will just go on and on. To understand this point is extremely important. It kind of places the responsibility where it belongs. And I like to say to patients at this point, as I'm explaining to them, you didn't catch diabetes, you earned it. Okay? You earn it from taking too many calories in and not enough calories out. And it's the normal physiologic response to too much in and not enough out. So it's actually pretty easy to picture how to reverse that. I've told this story to fifth graders, and I'll say, okay, I'm the patient, you're the doctor. How do you treat me? Well, they say exercise and decrease the calories in. So it's really not a difficult thing to understand. At that level, it's relatively easy to reverse.
Yeah, we don't, I mean, not, some people don't go to the doctor at all, but let's just say the average person maybe goes once a year for a physical. Aren't there markers that the doctors can find at that time? Because like you're saying, people could be living with this for years. At what point do they know it? Not until they develop symptoms, because doesn't the A1C kind of give a clue where a person is?
The A1C will miss about 20% of the people with diabetes. So it's not as sensitive as the fasting blood sugar or a glucose tolerance test. Now, we don't do the glucose tolerance test nearly as often as we used to. It's kind of a painful test, you know, to take this big bunch of glucose and then check your blood sugar every 30 to 60 minutes for 3 hours. It's not a fun thing to do. Now, but what we're bringing up is a very important point, I think. I graduated from medical school in 1981. Way back there, we diagnosed diabetes when the blood sugar got up to about 140, 145, and then we'd say diabetes. And you know, they changed it. Somewhere in my career, they changed it and they dropped it down to 125. Now, is that unfair? No, it's simply a recognition that this is a process that goes on over a long period of time. And almost immediately, I mean, within a month or so after I learned of the dropping the diagnostic number from 40s down to 125, they also said, okay, it's pre-diabetes if the blood sugar is between 100 and 125. So we're recognizing that this is a process. The diagnosis of diabetes, even the diagnosis of pre-diabetes, is a rather artificial line that a scientist has drawn in the line saying, this is where, probably policymakers as well, this is when it's worthwhile to start doing something about it, start prescribing medications, to start intervening in some sort of a way. Now, I think the drug companies were probably pretty happy to have the drugs being given earlier. They may have been part of the motivation for moving that. But for me, it's an opportunity for me to let the patient know that they can reverse it. And the truth is, the earlier you get it, the easier it is to reverse it, the earlier you see it. So the first thing that we usually see on a blood test is an elevated blood sugar. So fasting blood sugar over 100 or 100 or over, it would be considered, you know, that's showing some problems, to put it that way. There are other things that can be tested. And of course, we often check the cholesterol numbers. And if the cholesterol numbers, the good cholesterol is starting to go down and the bad cholesterol is starting to go up, that's an effect of increased insulin. Sometimes, and not always, but sometimes I will check insulin levels or some measure of pancreatic insulin function, because early in diabetes, as you're in the pre-diabetes phase or even before, we see the insulin levels going up. The insulin levels go up before the sugar levels go up. But that's not something that's often done. It could be done when understood correctly. An elevating insulin level would be a sign that pre-diabetes was on its way, as is raising the cholesterol, as is your weight going up and it's not coming off as easily as it used to, and blood pressure going up. I hope that helps.
Neil, that is very helpful. We have some questions from live viewers, but first I want to ask a question that I hear all the time is about the neuropathy. Mm-hmm. Even when somebody can reverse their type 2 diabetes, sometimes I hear that the neuropathy doesn't always go away.
That's true. I like the way you said it doesn't always go away. That's been my experience as well. But when I was in medical school, I was taught it never goes away. Well, fortunately, since that time, the science has demonstrated that it does go away or it can improve. I know I've seen people have dramatic improvement in their neuropathy. Moving to a plant-based diet, keeping the blood sugars under control, the anti-inflammatory effects of a plant-based diet can be beneficial. There's also randomized controlled trials in the scientific literature on some supplements that may also be beneficial to helping to reverse. I'll mention one of those because I've got a couple articles on them in my files, and that is alpha lipoic acid. It's instead of taking a medicine to numb the nerves down for neuropathy, I'll generally start patients on some alpha lipoic acid, maybe 200 or 300 milligrams a day. And it's not uncommon to have patients saying, hey, it's getting better.
Nice.
Mhm.
So here's a question from Amber. How close to oil-free and low fat should someone stick to in order to arrest and reverse diabetes and obesity?
You know, we don't have the complete answer on that. We don't have enough evidence to say if you go lower fat than another lower fat, it's going to be any better. You know, we don't know which is best. It really is the caloric restriction. And when I do this with people, it's just much easier to move plant-based and to get off the extra oils. If you really want this to reverse quickly, you need to get the calories down, and you want high nutrition, nutrient dense, not calorically dense. And nutrient dense foods are the whole plant foods. There is some benefit from some of the fats. For example, gamma-linolenic acid is one of those that has been observed to be of benefit, for example, for people with neuropathy. You probably know that the omega-3 fats can be beneficial for decreasing the triglycerides or fat in the blood and to help insulin sensitivity. But it's much better to get these things from the plants. If you separate them out and take them separately, they tend to deteriorate and can cause problems that way. So, and it's impossible to be a completely non-fat. Even lettuce, 9% of the calories are from fat. So if we can get it as the whole plant, it makes the most sense. And I suppose maybe the best answer to come back to you with is, well, how fast do you want to get better, right? So yes, we've seen people get better with a little fat in their diet. But if you really want to see it happen fast, then remove the free fat and get it from the whole plants. The whole plant has with it other things. I mean, one of these things we'll call the phytosterols. That is, it's a type of cholesterol that's in the plants. And when we have that, it seems to decrease our body's need to make cholesterol. So it tends to improve our health from that standpoint. So if you take it as the whole food, it ends up being better for you in the long run.
I never understood this obsession with oil. It's not a food. There is no oil in nature. Our ancestors didn't eat oil. And from a weight loss standpoint, how are people going to lose weight eating up something that's 4,000 calories a pound?
Oh, when you start taking it out from the, yeah, it's a real fat bomb or a calorie bomb.
I just said, did you want to share some slides? I mean, I don't know why I think you might have had slides prepared.
Well, you know, I didn't prepare any. I know last time we had a chat, things seem to go just fine. So yeah. I'll use word pictures if that's good with you.
That's absolutely fine with me. So let me see. I think I saw another question. Actually, I think it might have been, oh, here. It's not a question, it's a statement. And, you know, if we know that we already have a cure for diabetes, why don't more doctors know? Because I talk to doctors all the time and they've never heard of Walter Kempner and the rice diet.
Well, now, Walter Kempner was a really interesting fella. And I'm amazed, you know, there between World War I and World War II, here's this German fella who's doing amazing things, and he was kind of ignored by the medical community.
Kind of sounds like Dr. John McDougall, a person doing amazing things that's ignored by the medical community.
Well, you know, John McDougall is a little hard to ignore, okay? He's a real go-getter sort of a person, and I appreciate his energy. I've respected him greatly. He was doing this work before I was, and I've learned a lot from him and have appreciated his friendship and him as a colleague. I looked up to him for a long time. Fortunately for us, the science is now rather clear. I know that some people say diabetes is not reversible. And, I had this little resistance. Here I work in a medical community, and a lot of people say, that can't be done. About, what has it been now? Probably 4 years ago now, I decided to take a big step and try to, again, meet the resistance head on. I said, we really need to change how we're doing these things. So I wrote our chief medical officer a little email. And he had stated to someone who passed it on to me that what Dr. Guthrie was doing was marginal, right? And that's not real medicine. So I sent him a little email and I said, in 2012, Roy Taylor received the Banting Award from the American Diabetes Association for proving that diabetes is reversible. And he showed how it was done. And then I pointed out that from that, there's another trial called the DIRECT trial, a multi-center trial in the UK, showing number needed to treat of 2 for in the primary care office reversing diabetes, that is bringing the sugars down to normal. Well, that's pretty interesting. When we talk about medication effect, there isn't anything that gives us a number needed to treat of 2. Let me explain that. Number needed to treat is how many people do you have to treat in order to get the outcome. So in their DIRECT trial, they showed that you had to treat 2 people to reverse diabetes in 1. Well, that's better than any medication. So that's now evidenced and going on. Now, it's true that year 2, there's a little recidivism. Sometimes people will gain a little weight back, but if they'll get that weight off, we see that diabetes reversed. And then I also, because I included these papers when I sent him the email, I sent him an article by Van Omen. Now, Van Omen and his team are out of Scandinavia, and they kind of lay out, this is what we need to do for our whole system, medical system, medications, drugs, social, societal, legal. These are the things we need to do in order to really reverse these diseases. So it's laid out. It reviewed the literature, from one end to the other, an exceptional article. So I sent these to him and I said, reversing diabetes is no longer on the margin, it's the cutting edge. So it was from there that we were able to actually get a little bit of traction to try to help people. Nice. So that's been a pleasure for me, and I have enjoyed working on that project. Now, I will tell you, I'm still a little frustrated. I do have a lot more support now from the medical community. Those that work with the Diabetes Institute, for example, the head of the Diabetes Institute was invited to the American College of Lifestyle Medicine meeting here a couple of years ago. And afterwards, he said, George, we need to make plant-based nutrition part of the way we treat diabetes in the Diabetes Institute. The evidence is there. So that was been encouraging to me. And we have now endocrinologists who understand how important this is. There's a growing understanding, but there's still a big resistance in patients. They want a pill.
Well, resistance in patients, doctors too, because even though the evidence is there, and I know Kaiser published a paper about this, they still, their recommendation is almost always keto or low carb.
Oh, I know. That's so frustrating to me as well. Mm-hmm. That's kind of part of the doctor group. They look at the lifestyle side and they think keto is the place. The evidence is kind of poor for there. There is a big randomized controlled trial, to my understanding, going on right now, but we have no answers from that. All we had was an observational trial. Well, it was an interventional trial without a control group, and some people had improvement. But keto is not the way our bodies are supposed to be built. And there's so much evidence in other scientific literature. For example, large well-run prospective epidemiologic studies that tell us the more animal protein you put in, the sooner you're going to die and the more diseases you're going to have. So simply saying, well, kidney failure, I mean, there's a bunch of different
and
effects.
welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I'm so sorry that happens occasionally. The thing keeps playing. Please continue.
I must have stepped on your toe. I apologize.
No, this happened yesterday too. I'm so embarrassed.
So, keto it is illogical when you really understand the nutrition. I know they say they're trying to decrease insulin by getting people off of carbohydrates, so they move to protein, but they fail to understand that protein stimulates insulin too. Arginine, for example, is used to really stimulate the pancreas hard. That's an amino acid. And so there's still insulin that comes with the keto.
Yeah. Tammy, who's watching live, says, is it just too much food or too much fat?
It's kind of a combination. And maybe let me explain the fat issue. When you get free fat, it goes into the cell. Our cell has energy kind of creating packets that we call mitochondria. So mitochondria have this process that goes on inside where they take food energy and turn it into cell energy. Cell energy is called ATP, and you kind of have to have that switch from food energy to cell energy to make things happen. So that energy is made primarily, you've probably heard these terms, first anaerobic respiration and then aerobic respiration. So we call it the Krebs cycle that uses the oxygen. It's the most efficient way of taking food energy and turning it into ATP. Well, sugar comes into that Krebs cycle to be with oxygen turned into energy in almost exactly the same place that fat does. So when there's a lot of extra fat, the fat will go into the Krebs cycle and it'll go so fast, it'll come back and stop the sugar from going through. So you have sugar going up inside the cell, and then the sugar, because it's high inside the cell, will not come in from the outside. Even if the insulin works and opens up the glucose transporters, because it's a passive diffusion, that is, the glucose comes in because there's not enough in the cell. When it's built up in the cell, then that drive to have the sugar go into the cell is not there. We've known for years you could take healthy medical students, give them a high-fat diet, and turn all their tests positive for diabetes. And fat will do that all by itself. Go ahead.
I'm sorry. There's this compelling video of a guest I've had on before, Dr. Nick Delgado, where he literally gave himself diabetes in 6 hours just by drinking olive oil. It was really interesting to watch what happened to his cells and his numbers.
And the fat goes into the cell without insulin. It just goes in and it can clog up that whole system. So yes, it's total calories, but fat has a especially effective, especially when there's large amounts of it, it's especially effective at clogging up that energy system. And when that system is clogged up, it makes a whole bunch of free radicals. Those free radicals create inflammation. Where it's most likely to happen, where it happens first, is right there in the blood vessel wall. And you start to have blood vessel wall inflammation. The whole body starts to get inflamed. It's really an amazing system. And it's an amazing bunch of pathologies that follow this excess of calories in, fat and carbohydrate, and to a degree as well, proteins can also cause problems as well. So yeah, it really is total calories. So decreasing the calories is the primary challenge. And the easiest way to do that is by moving to whole plants. Well, you could do it in a Chinese prisoner of war camp. Yeah, that would work. Right. No matter what they fed you.
But I think the easiest way to reduce total calories without having to eat less food is to reduce the fat content.
Well, that's true. I would argue, and increase the fiber content.
Well, absolutely.
Okay, because that will fill you up. Refined carbohydrates are a big problem too, right? So I tell patients, cut down on the fat, find foods that are low in fat and high in fiber. because fiber will fill you up and do 100 other things to help improve your health.
Right. Listen, Brandy writes, a live viewer, just tuning in and want to share that I changed my diet to whole food plant-based in March 2021. And by September 2021, my A1C had dropped to the normal range. I was diagnosed with type 2 diabetes 9 years ago. So in other words, it's never too late.
Isn't that great? And, you know, we have a little joke here in the office. They call it COVID-19 because it's not going away till everybody gains 19 pounds. At least it seems like people keep doing that. So, you know, I think this is great that somebody actually used COVID as an opportunity to reverse their diabetes. That is wonderful.
It's amazing. Kathy says, what if you're whole food plant-based, but your A1C is still high enough to still be on meds? Go to True North.
Well, that's an interesting question, and it's not quite as easy as some people make it sound. There are some people whose physiology, because everybody's kind of diabetes is just a little bit different. If you've had the diabetes for some time, there's actually death to the cells in the pancreas that make insulin. So I worked for about 5 years in a live-in place where people would spend, I don't know, $7,000, $8,000 to come for a couple of 2.5 weeks, and they would try to get off their insulin. I could identify who was not going to be able to get off their meds by measuring their pancreatic function. If their pancreatic function was too low, I knew they were going to need insulin when they got done. They could reverse the insulin resistance, but they couldn't build their pancreas function back fast enough. And those people who have lost their pancreatic function will not be able to completely get off medication. Some will be stuck on insulin. Many can stop a lot of the medications as the rest of the body normalizes. But there are some parts of the disease that is much more difficult or are much more difficult to reverse. Now, I will say there's a lot of hope. We now know, for example, and a little explanation for this, people with type 2 diabetes, the longer they have it, there are little islets of Langerhans with the little cells in them that make insulin. We call them beta cells. They tend to die with time. That happens in all of us, even of those of us who don't have diabetes. And when a cell dies, a beta cell dies, it's replaced normally by a pluripotential cell from the exocrine pancreas. It migrates over from one of the tubules, takes the place, and starts to do the work. When you have type 2 diabetes, because the sugars are high, because of the increased inflammation, and maybe other things as well, that transfer doesn't take place. So over time, the number of cells in the pancreas that can make insulin shrinks slowly. Now, science has actually identified the molecule that stimulates those cells to move. So it's not available as a drug, and I suppose I'm kind of glad for that. But there is evidence that we can kind of fix that system. And I don't know if you, Chef AJ, have talked at all about the fasting mimicking diet.
I've heard of it, Walter Longo.
That's right, Walter Longo, if I remember correctly, UC Davis there in California. But it's pretty fascinating work, because when the fasting mimicking is done, there's actually a stimulation for these new cells. And so we have some evidence that by using something like the fasting mimicking program, you can help your body kind of rebuild some of those things. So he's been able to, for example, in mice, he was able to demonstrate in 5 cycles of fasting mimicking diet, a complete rebuild of the pancreas where the beta cells had all been destroyed by a drug, which was, you know, they meant to do that to see if they could rebuild the pancreas. So the fasting mimicking was able to do that. And I have sent some patients, I said, your pancreas is weak. Yeah, we have drugs, they're expensive. They may help. But if you really want to, you know, do it the natural way, then look into fasting mimicking.
Yeah, thank you. There's a question from Cynthia. What about glutathione?
That's an interesting sort of a topic. It seems a little bit tangential, but I can explain it. Glutathione is your body's own natural, and I'm going to say vitamin C. It's an antioxidant for the water part of the system. You know, we have vitamin E that works in the fat part of the system, along with coenzyme Q10 and some other things. But in the water system, glutathione is an important antioxidant. Now, glutathione is made from 3 little amino acids, and when they kind of come together in the right pattern, they will work to help take care of free radicals that happen and deal with inflammation. Now, decreasing inflammation can help the body, and it can help diabetes as well. But I'm not sure of how best to tie your glutathione question in with reversal of diabetes.
Well, maybe it came when we were talking about neuropathy, because she said something about it seemed to help muscles.
Okay, that could be. Certainly, you know, glutathione is not absorbed very well. Those who make the supplements will put it in little kind of packets to try to get it through the gut, because it doesn't go in naturally and easily. Our body does make it if we have the building blocks. So maybe you've heard of N-acetylcysteine. I mean, that's a supplement that is sometimes used. The body turns N-acetylcysteine into glutathione. It just adds one more amino acid, and then you have something that can work in the antioxidant system. I will also say that glutathione needs selenium to work. So when someone says selenium is a good antioxidant, it's because it's working in our body with glutathione. It helps to kind of reactivate the glutathione after it's grabbed a free radical. So selenium kind of fits into that as well.
So many doctors and lay people too say, well, they can't eat carbs, and we're not talking about sugar and flour or alcohol carbs. They're talking about potatoes and rice, because their blood sugar goes up. And this is the common belief when people go to their doctor, to not eat the foods that we eat.
Yes, that's true. So I have a lot of patients, and many that will come in and say, you know, I'm on keto. And my response is, tell me about your keto. What kind of keto are you on? Well, I'm eating, you know, chicken, and I'm eating fish, and I'm eating salads, and I'm staying away from the carbs. And I say, well, good for you for eating those salads. They're full of all kinds of fiber and antioxidants, and they're low fat, and that's wonderful. But did you know that the animal proteins are a little bit have problems to us? They stress the kidneys. They tend to shorten our life and increase risk of cancer. You know, there's a better way for you to get your protein. Maybe you could get it from legumes or beans. So the beans are beneficial because they have about the same amount of protein in them as far as percent calories as one has from any of the muscle meats. It's around 22 to 26%. Of course, depending on how marbled the meats are, the numbers can be different. But beans are a really good source of protein. And instead of having the fat, which clogs the system up, it has a better kind of protein that's not so hard on the body. And you have all the fiber that comes with it. And that helps to lower your appetite. And so I then introduced the whole concept of good carbs. So yes, there's bad carbs. Good for you staying away from that white junk. Those do nots are called do nots for a reason, because they're not good for us. But we do need to have the foods that have the carbohydrates that have the fiber in them. It's an important part of our health. So I try to encourage people in that direction. Several years ago, a fellow by the name of David Jenkins from the University of Toronto did a great kind of article. This was in the days of Atkins. Remember, Atkins was kind of before the keto. And so he put it to the test and did a plant-based keto, and took people off all their white stuff, all the refined carbohydrates, and put them on legumes instead. And what do you know? The benefits were all there, you know, the weight loss and the cholesterol changes and those types of things. So I try to encourage people to go to what Dr. Jenkins called Eco Atkins. That is, get your protein, get your high protein from plants, legumes in particular. And of course, then you get good carbs and you get lots of fiber, and the benefit is there.
What do you eat, Dr. Guthrie? People love to
Ooh.
know like a day's worth of food for our guests.
Well, let's see. This morning I had quinoa and probably a little over a half a cup of some kidney beans, a fruit plate with some berries and apples and whatnot, and a handful of nuts. I like the mixed nuts, so a little bit of some almonds and some cashews and some others, just because there's a lot of good things in those nuts, selenium and other micronutrients, as well as the healthy omega-3 fats. So that's what I had for breakfast this morning. Last night I had nothing to eat because I stick with most of the time this intermittent fasting or time limited eating, just to try to sleep better and to spend as much time as I can within that fasting state, because it does decrease inflammation and increase, dare I say it, brain cells. We tend to do better when we have that fasting each day. For noon yesterday, my wife sent me a great dish of beans and rice and then a salad. So that was my lunch yesterday. Today, unfortunately, I had to eat in the doctor's lounge, and that's a little bit harder. So they had a little pasta and sauce and some veggies. So I kept it kind of small, and we'll tend to do okay then. Yes, the sauce was tomato sauce.
Does it matter though? I mean, I understand the concept of intermittent fasting. Does it matter what the window is? I mean, is it not acceptable to just, eat 8 hours a little bit later in the day? Because that's what I'm not doing it for the factors, the reasons people do it for. I just naturally don't eat in the morning because I have too much to do, exercise, walk my dog, and I eat lunch around 1 and dinner around 5. And my window's like 6 hours, 8 at the most. And that just seems to really work for me because I like to have at least, 4 to 5 hours before going to bed.
Yeah. Going to bed with an empty stomach is really a wise thing to do. Well, the study has been done. It was done in Czechoslovakia, at least the one that I have the copy of. And what they did was they took people with pre-diabetes because they wanted to get fat out of the liver. If you really want to reverse diabetes, then this kind of time-limited feeding or intermittent fasting is helpful. And they had either breakfast and lunch or lunch and supper. So the two were compared. And the people were actually switched back and forth so they could see which was the most effective, and each became their own control. It was very interesting. The breakfast lunch was better at removing fat from the liver than the lunch supper group. So yes, I can tell you it makes a difference. While both of them will work to help improve the diabetes, reverse the underlying process, the breakfast lunch one is actually the better one.
But is it better to do it the way I'm doing it than to not do it at all?
Oh, yes. You can do it either way, but if you wanted to know what the best way was, I think we have some really good evidence on that.
But I don't like eating in the morning, and nobody eats. I mean, it's not like when we gather with people socially, it's never for breakfast.
Yeah, the social business at night is a little bit of a challenge. From my standpoint, as someone who's still going to work, my wife really appreciates not having to fix supper in the evening. So for her, it's beneficial. For me, it's beneficial because now I have time to actually exercise. So I'll look at it from that standpoint. So, and I'll say to you that if you did not eat that second meal in the evening, you'd be hungry for breakfast and you would eat breakfast.
I've tried that and it didn't work. I've tried that. It doesn't work. I just don't get hungry till 11, 12 or 1. And I've tried that. I even went 21 hours without food. I still didn't get hungry till the time I get hungry. I don't know.
Our bodies are trainable. And so with time, they do change. Sometimes it takes
I don't want to.
That's fine. It's up to you.
It's so funny. I know. It's just, but what's funny? My husband wakes up and he's starving the minute he wakes up. I think people might be different. I don't know, but I can't
They are.
exercise. I can't exercise if I've eaten. I can tell you that. That's a fact. So Elizabeth is wondering, because we talked about the A1C. If that's not the most sensitive test, why is that the one they always do? Why don't they do the other tests?
Well, if I like this picture. There's a picture in my family album from when I was young of my father in medical school, standing next to a 47 Chevrolet Fleetmaster convertible, holding his eldest firstborn son, me. Okay. It's a black and white photo, and it's nice. It brings back memories, but it only gives a snapshot. It's much more fun, one might say, to watch home movies where you're getting much more than just the black and white. So when you take a blood sugar, it's just the black and white photo. You got one spot. Yes, it's got memories. It tells you where your sugar was. But what really matters over the long haul and increases your risk is what you're doing all the time. And so you need a movie, something that will tell you what's happened over a period of time. And indeed, the A1C is a good way of getting that picture. It goes beyond simply the elevated sugar at one time and tells us about damage to the proteins in our body that happens when sugar attaches to them. And because we're looking at red blood cells live about 3 months. So we're learning about the average blood sugar over 3 months. And because it's reflecting damage to the protein, it's also a much better reflector of the problems that may occur to us or be occurring to us in our eyes, in our kidneys, in those small places of the body where damage is happening slowly. So the A1C is actually very good at predicting the secondary pathologies, the bad things that are happening within the body. That's why we use it. And we say you need to get your A1C less than 7. Of course, I like to have people get it lower, back to normal is what we'd like to see without medication. But every time, for example, if you double your A1C, you go from 7 to 8. Oh, I'm sorry, that's not right. If you go from 7 to 8, you double your risk of a heart attack. You go from 8 to 9, you double it again. You go from 9 to 10, you double it again. There's that damage that's happening within the tissues, and you're going to pay for it someday. The goal is to keep that from happening.
Right. Oh, I almost missed this good question from Debbie, who's watching live. What about the people on the keto diet or Dr. Hyman saying they are reversing diabetes, but with a high fat diet?
Oh, isn't that great? They've defined diabetes as only blood sugars. That's what the problem is. They're completely ignoring the other parameters, the inflammation and those other things. And that's very interesting because when you look at their study, there are other parts of the body that were not getting better. Diabetes is much more than a blood sugar problem. It has a lot to do with inflammation. It has small blood vessel damage. And interesting, their heart attack risk doesn't go down. So that's another important part of the kind of diabetes, heart disease, metabolic syndrome picture.
It's so frustrating knowing what you know, isn't it? And seeing how people just...
The keto diet brings the cholesterol down, but it doesn't lower the heart attack risk.
Yeah.
And cholesterol is not a disease. It's a marker. What we really care about is the disease. Blood sugar is not the disease. It's a marker. What we really care about is the whole underlying disease. That's what needs to be reversed.
Okay. Kathy's saying, do you think people should take omega supplements?
If one is on a plant-based diet, it's completely unnecessary. I taught years ago just in the nutrition area, graduate nutrition, and I had remember these overheads where you get it on this clear celluloid and you...
Oh my God, I did the overhead projector.
Yeah, that's it. Okay. So I had these slides where I would throw up and show people how much omega-3 there was in cucumbers and tomatoes and lettuce. It's all over.
There's a lot.
Now, so you don't have to worry about it if you're 100% plant-based. Now, I will add a little bit of a little insight into that. If you've been on an animal-based diet for a long time, you've got a lot of trans fats.
I'm so sorry. I don't know why my computer is just talking today.
Well, I think it's just letting us know we've been at this too long.
Right. No.
So stepping back, if you've been eating an animal-based diet, you're likely taking in a lot of arachidonic acid, a very inflammatory, a kind of long chain fatty acid. And as we have a lot of these over time, they end up getting stuck in our cell walls, and then they're released and they cause inflammatory type responses. It takes those a long time to change, maybe more than a year. So when someone is making a transition, because, for example, arachidonic acid feeds back and blocks your own body's ability to make icosapentaenoic acid, the fish oil that we would sometimes supplement. It takes a long time. So there's some logic to taking an omega-3 and it's in its animal form for several months if one is making a transition, especially if one has a lot of inflammation in their body, aches and pains and arthritis and those types of things. So I wouldn't recommend it long term. I do not take any omega-3 replacement, because to me it makes no difference. I'm getting it in the nuts and in the vegetables and to a certain degree in the fruit as well.
Great, thank you. What about exercise? Is it something you especially recommend for people with diabetes, and is it something that you personally do?
I do. I try to exercise on a regular basis. When it's raining outside, sometimes I don't get as much as I would like. Today at lunch, my lunch break, and remember I'm on the East Coast, so that has passed several hours now. It's raining here, so I went to the hospital parking garage and I walked in the parking garage, try to get that exercise in. And this evening I'll try to do a little bit of a run. So exercise is very important to help reverse insulin resistance and keep our weight in control. It's also important for keeping our muscle mass up. Our muscles burn between 35 and 50 kilocalories or calories per day while we're just sitting, not when we're exercising. That's the basal. So the more muscle I have, the more calories I burn while I'm sleeping. And this helps to control the weight and keep it where it belongs. So yes, exercise is very important. Now, I will say, when people have diabetes and they have the degenerative diseases and the joints hurt, it's hard for them to exercise. They recognize how important it is. And it's extremely common for them to start to exercise and then hurt themselves. So I would like to kind of pop the perspective that says no pain, no gain. Because if you're going to hurt yourself, you're not going to do the exercise and you're not going to gain the benefits. So the exercise needs to be mild to moderate in such a way that you don't hurt yourself. Just walking until you're slightly out of breath and then slowing down, and then walking a little more as your breath comes back. So kind of back and forth like that, and then slowly build up. If you try to jump in and do it all of a sudden, now you're going to hurt yourself, and that puts you back even further than you were when you started.
Right. Well, this has been so wonderful. Now you don't see patients, so how do people find more about you? And
no, I do see patients, but I don't have a lot of slots. That is, it's a pretty busy place. I'm spending most of my time supervising young residents, but I do spend about 3 half days a week seeing patients, sometimes with the residents, sometimes by myself.
If somebody in Orlando really, really wanted to see you, could they?
They do.
Nice. Are you active on any of the social medias if people wanted to?
I'm not active on the social media. I don't have time for that. So.
Well, that's because you're a real doctor, but you had time to write a book. So we'll tell people where to get that.
Okay.
And you had time to be in a movie. So that was great.
I guess that's right. That's right.
See, you make time for the things you like. I'm just teasing. Well, thank you so much, Dr. Guthrie, for your service to the American College of Lifestyle Medicine and to making people healthy.
It's a pleasure to have shared this time with you again, Chef AJ. You're always such an engaging person, and I appreciate your questions. I appreciate your listeners, and I'm glad to see this whole community growing.
Great. Thank you so much. And thanks all of you for watching another episode of Chef AJ Live. Please come back in 1 hour when I have Charity Morgan from the movie Game Changers making a recipe from her new book, Unbelievably Vegan. Have you seen the Game Changers movie, Dr. Guthrie?
I have, and I love it. I had the opportunity to be with the author over here at NASA. We had a kind of a health talk, and we were on a panel together. So I feel like I know them personally.
That's fantastic. Well, you take care, Dr. Guthrie. Thanks so much.